Covid-19 is an infectious disease caused by the recently found virus known as SARS-CoV-2. Before the outbreak originated in Wuhan, China on December 2019, there was no information about this virus. SARS-CoV-2 is a new virus. The first cases were identified in people with pneumonia in Wuhan, China in late December 2019. It probably started in animals but is now spreading between people. As this virus is new, we are learning more all the time, and what we know now may change. Symptoms of COVID-19: high fever. The body temperature can exceed 37.3 Celsius degrees or 99 Fahrenheit degrees. Tiredness. The body feels completely tired and without energy to perform normal tasks. Dry cough, irritation and constant coughing without expelling any mucus. How is COVID-19 spread? Most people are being infected from other people when in close contact. It probably spreads the same way as colds and flu, through droplets which are created when we talk, cough and sneeze. People in close contact can get infected when these droplets enter the nose, eyes or mouth, or when the infected droplets are inhaled. Touching contaminated objects puts the droplets onto your hands. If you touch your face, the droplets can enter your nose, eyes and mouth. Infected people with minimal or no symptoms can spread COVID-19. Symptoms start like many other illnesses. Common symptoms include fever, cough, sore throat, fatigue, shortness of breath. Symptoms start about 1 day after exposure but can be as long as 14 days. Most people develop symptoms within 5 to 6 days. It can also cause many other symptoms including headache, muscle aches, sudden loss of sense of smell and taste, runny, stuffy nose, diarrhea, rash. Some people have no symptoms, most have a mild illness. It can be severe and sometimes fatal. Many patients recover fully in about 2 weeks. In others, some symptoms like breathlessness and fatigue may continue for weeks and months. Many people infected with COVID-19 show mild symptoms, especially during the first stages of the disease. Thus, you can still catch the disease from an infected person who only has a mere cough and does not feel ill. Tiredness. The body feels completely tired without energy. Dry cough, constant coughing without expelling any mucus. High fever. The body temperature can exceed 37.3 Celsius degrees. Difficulty breathing. Breathing actually feels more difficult. Prevention measures. Antibiotics do not work against coronavirus. Protecting yourself and preventing the spread of the disease. Wash your hands with an alcohol-based sanitizer or with soap and water. Keep a distance of at least 1 meter between yourself and anyone who coughs or sneezes. Try your best not to touch your eyes, your nose and your mouth. Cover your mouth and your nose with your bent elbow or a tissue when coughing. Seek medical attention if you have difficulty breathing and a high fever. Follow the directions of your national or local health authorities. Protection measures for people that are in or visited infected areas. Stay home if you do not feel well, even if you feel mild symptoms such as headaches, slight fever and a runny nose. If you need to go out, for example to buy food or supplies, wear a mask to minimize the risk of infecting others. If you have difficulty breathing and/or a high fever, seek medical advice as soon as possible. Call your provider and inform them of any recent travel, especially to countries with reported cases. How to use a mask. Before wearing a mask, wash your hands with an alcohol-based disinfectant or with soap and water. Cover your mouth and nose with the mask and make sure the mask is firmly pressed against your face. Do not touch the mask while you are wearing it. If you do, wash your hands with an alcohol-based disinfectant or with soap and water afterward. Replace the mask as soon as it gets wet and do not reuse disposable masks. Remove the mask from behind, do not touch its front side, throw it away in a closed container and then wash your hands with an alcohol-based disinfectant or soap and water. Thanks for watching.